Hi, everyone. I'm Dr. Sarah Ellis, a naturopathic physician and natural products researcher, and I am so excited today to discuss a very interesting topic. We'll be talking about berberine and whether or not it can truly be considered nature's Ozempic. So let's jump right on in and talk about berberine. Let's discuss what it is, its benefits, and also how it's been used traditionally and currently. We will also discuss the ways in which berberine compares to Ozempic. We'll also talk about the safety considerations when using berberine and exactly how to use it clinically with your patients. So let's introduce berberine. It's a natural alkaloid found in several plants, including many common medicinal plants like golden seal, Oregon grape, and barberry. It has been isolated from the bark, stems, roots, and leaves of various plants. And berberine itself has a lot of pharmacological activity. It has been shown to be antimicrobial, glucose lowering, cholesterol lowering, and immunomodulatory. Historically, berberine containing botanicals have been used for thousands of years. It has a long history of medicinal use in traditional Chinese medicine, specifically for the treatment of a wide variety of conditions, including tuberculosis, periodontitis, dysentery, pharyngolaryngitis, eczema, and a variety of wounds. It is a traditional remedy for correcting liver function and even supporting bile flow, which means it's indicated for a variety of bile or gallbladder conditions, including gallstones and gallbladder inflammation. As a bitter tonic, it also has mild laxative effects. So specifically, the botanicals that contain berberine have been found to have mild laxative effects and has been considered a great alternative for skin conditions, including psoriasis and acne. Berberine and berberine-containing botanicals can be used topically, hence its activity, using it in skin conditions, and it has been seen as an antimicrobial that can target Staph aureus, Candida, H. pylori, and many more. Let's hone in specifically on its antimicrobial activity. We see here that berberine has a very unique mechanism of action when it comes to its antimicrobial activity. It's been shown to target the bacterial cell wall and the cell membranes. It can also target bacterial genomes, so the DNA and RNA. And it has been shown to inhibit protein expression, specifically as it pertains to efflux pumps. And we'll talk about that in just a little while. It's also been shown that berberine can actually potentiate the antimicrobial and antifungal activity of a variety of drugs. So it enhances those drugs' ability to eliminate certain pathogens, whether they are bacterial or fungal. It's also been shown to interrupt the biofilm matrix of a number of pathogens, including Staphylococcus aureus, C. diff, as well as Pseudomonas. Now, as I mentioned earlier about the efflux pumps, berberine's ability to impede the production of these efflux pumps is really huge. So bacteria use and create these efflux pumps to essentially spit out anything that may be considered toxic to it. So as you are giving your patient an antibiotic, this bacteria has the capability of essentially spitting it out and allowing it to survive and not be killed by the antibiotic. Now, berberine has been shown to reduce the number of efflux pumps and kind of close off those efflux pumps that different bacteria make. So essentially, it's preventing that bacteria from spitting out that antibiotic and allowing the antibiotic to increase in concentration and eventually kill the pathogen. Let's look at this diagram, which is a really unique diagram to show how berberine impacts biofilm production and maturation. So here in image A, we see that this is S. typhimurium, and we see that berberine can inhibit its ability to establish a biofilm by inhibiting Fim-A production, which is a protein that creates these fimbriae or little projections off of the surface of this bacteria. Now, berberine is able to prevent how many of these projections are produced, and this prevents S. typhimurium from attaching and creating and establishing those biofilms. Now, when we look at Pseudomonas aeruginosa, we can see that berberine is able to inhibit a number of pathways associated with biofilm production. We see that here, not only can berberine impact the ways in which the bacteria can adhere to surfaces, it also inhibits microcolony formation. So the very beginnings of biofilm, berberine can interrupt that. And in addition, berberine can also interrupt the maturation of biofilms. So biofilms are essentially a community of bacteria that secrete compounds that prevent it from being killed by antibiotics. It also allows the bacteria to communicate with each other and share cheat codes and unique information that allows it to evade the immune system or toss out and spit out those potent antibiotics. Well, berberine is able to reduce the maturation of the biofilms. So the biofilm doesn't get a chance to really set up the way it needs to. And that bacteria, they're not able to communicate with each other the way they normally would. And then here with image C, we see that berberine can also inhibit a number of pathways involved in the biofilm creation with Staph aureus, which is really important when it comes to methicillin-resistant Staph aureus. So we see here that berberine is able to impact the entire life cycle of biofilm production as it pertains to Staph aureus. So berberine is able to inhibit Staph aureus' ability to adhere to certain surfaces, to establish microcolonies, to allow that biofilm and those multiple microcolonies to mature and establish, but it also is able to impact dispersal. So sometimes with biofilms, little pieces of bacteria can break off and go on to other parts of the body where it can establish new biofilms. And so berberine is able to inhibit that dispersal and really begin to either prevent biofilm establishment or impede and interrupt its ability to mature and prolong and stay in the gastrointestinal tract or wherever you may see one of these biofilms. Now, berberine does not just impact bacteria, but it can also target pathogenic yeast. So we see here, this is an image and two graphs comparing biofilm variability when exposed to berberine here on the left and fluconazole here on the right. Now, fluconazole is a very popular and commonly prescribed antifungal and often used to address candidiasis or candidal infections. Now, this study specifically looked at Candida tropicalis. Now, one of the things I want to point out here is that fluconazole at its highest dose, so just over 1,000 micrograms per mil, at this dose, fluconazole is able to reduce the biofilm viability by about 50%. So it's able to kill off about half of the biofilm present at that dose. Now, on the other hand, berberine, we're able to see here, is able to reduce 50% of that biofilm at just 37.5 micrograms per mil. So at definitely a significantly reduced dose, berberine is able to significantly reduce biofilm variability even below 50% when compared to the maximum dose used here with fluconazole. So now that we know what berberine's activity is with the antimicrobial activity and how it is able to inhibit the growth of pathogenic microbes, let's take a look at berberine's impact on blood glucose. So as we know, berberine has long been used and known for its blood glucose lowering activity. Now, this table is from a 2017 clinical trial involving 80 patients with metabolic syndrome, and they split them into two groups. The observation group was given berberine, and the control group was given the usual conventional methods of addressing metabolic syndrome. So if they had type 2 diabetes, they were usually given metformin or a similar glucose-lowering drug. If they suffer with hypercholesterolemia or hypertension, they were also given statins or ARBs or ACE inhibitors for hypertension and cholesterol. Now, during this study, they found that berberine was able to induce insulin secretion, so it increased how much insulin was released from the pancreas to lower blood sugar levels. It also reduced insulin resistance and increased insulin sensitivity. It was also found to improve the activity and promote the proliferation of beta cells in the pancreas. And this is quite important, as you know, because these beta cells are the ones that are responsible for producing insulin and making sure that our blood glucose levels remain in a healthy range. So now that we know the ins and outs of the story and of the study, let's take a look at what they observed. Now we can see here in the observation group, remember this is the group that got berberine, their fasting glucose after a week of taking berberine was about 7.9 millimole per liter. After a month, that dropped down to 5.6. Now in the control group, who were getting metformin and other glucose-lowering drugs, their fasting glucose after a week was 8, so very similar to the observation group, the berberine group. But after a month, we see quite a stark difference. So we see that after a month on the clinical or the control group, their fasting blood glucose was up to 6.5 compared to a 5.6 in the berberine group. And we can see similar patterns in the 2-hour postprandial glucose levels. A month after taking berberine, it was a 7.5, and a month after conventional treatment was an 8.5. Now, insulin resistance saw pretty similar patterns in both groups. So both the control group and the berberine group saw steady levels of insulin resistance. But we saw a modest reduction in triglycerides, but also definitely saw a reduction in total cholesterol in the berberine group compared to the control group. Now let's look at this same study, the same group, but I want to look at the presence of inflammation. In the study, they measured high sensitivity C-reactive protein, which is a gold standard biomarker when measuring inflammation. And so we see here, not only did they look at CRP, they looked at two very common pro-inflammatory cytokines, interleukin-6, IL-6, and tumor necrosis factor alpha, or TNF-alpha. And what we see here is a week after taking berberine, it was a 12.3, their CRP was 12.3, and a week after doing the usual therapies, the conventional therapies, it was a 14.6, so a bit more elevated after a week. But we saw a very big difference between a month of taking berberine and a month of doing the usual treatments. And what we saw is that C-reactive protein reduced to 8.5 after a month of being on berberine compared to 11.6 after a month of being on the usual conventional treatments. But the marker that I saw, one of the most stark differences in reductions, was TNF-alpha. After a month of being on berberine, these participants saw a reduction in TNF-alpha at 83. And a month after being and using the conventional methods, their TNF-alpha did see a great big difference between a week after and a month, but it still was nowhere near as low as the berberine group. So why is this important? Well, the researchers found a very unique pattern. They found that high sensitivity C-reactive protein, or inflammation, was directly correlated and had a linear relationship with many of the biomarkers that are elevated in metabolic syndrome. So we're able to see here that high sensitivity C-reactive protein, when it is elevated, you also see an elevation in fasting blood glucose. Not only that, but we also saw a linear increase in triglycerides and insulin resistance. So what exactly does this mean? This is showing a pattern that shows that as inflammation increases, the biomarkers that are signs of disease, often metabolic diseases like diabetes, high cholesterol, and hypertension, all of those biomarkers also increase when inflammation increases. And so when choosing ways to support patients that have chronic inflammation, whether it's due to a chronic disease like type 2 diabetes or an autoimmune condition, we want to make sure that we are choosing options that are reducing inflammation, because as we reduce inflammation, we also see reductions in blood glucose, triglyceride, and insulin resistance. So now let's talk about berberine and weight loss. Now, I really wanted to make sure that I mentioned weight loss here with berberine because we are comparing it to Ozempic. And Ozempic and other semaglutide pharmaceuticals are known for their ability to facilitate weight loss. So let's take a look at how berberine compares. So there have been small studies that measure and have been able to determine how well berberine can facilitate weight loss. So in 2020, we had researchers that conducted a meta-analysis, and they looked at hundreds of studies and were able to narrow it down to about 12 different clinical trials that assessed berberine's ability to support weight loss. And here's what they found. They found that supplementing with berberine significantly reduced body weight. So on average, they saw about a 4.5 to 5 pound weight loss across the length of the study. It also saw a reduction in BMI, or body mass index, along with waist circumference and C-reactive protein levels as well. Now, it's important to note that these studies some of them were small and kind of poorly designed. So there is a definite need for robust, well-designed studies to fully ascertain berberine's ability to support healthy weight loss. All right, so now that we know and have a good understanding of what berberine is, how it's been used traditionally, and also some health benefits associated with berberine, now let's compare it to Ozempic. Now, of course, we have to begin by discussing what Ozempic is. Now, Ozempic is an injectable pharmaceutical drug, and it's designed to treat type 2 diabetes. Now, the FDA approved its use in type 2 diabetes in 2017. Its primary active ingredient is semaglutide. Now, semaglutide is a GLP-1, a glucagon-like peptide 1 agonist, so it stimulates the activity of glucagon-like protein, and it works by increasing insulin release. It lowers the amount of glucagon that is released from the liver. And remember, glucagon is our storage form of sugar. It also delays gastric emptying. So that in and of itself is going to reduce your appetite and help facilitate weight loss. We're also going to talk about Wegovy. Now, Wegovy is also an injectable pharmaceutical and is made by the same company that makes Ozempic. Now, Wegovy also has semaglutide and in some forms has a higher dose of semaglutide, but it was specifically approved for weight loss. So in 2021, the FDA approved Wegovy specifically for weight loss. So this is a form of semaglutide that should be used for weight loss, and then usually Ozempic is reserved for type 2 diabetes management. Now, both Ozempic and Wegovy are administered weekly via subcutaneous injections. So let's take a moment to discuss the similarities and differences between berberine and semaglutide. Now, berberine and semaglutide do share a lot of characteristics. They both support weight loss, they both lower blood glucose, and they both lower both postprandial blood glucose levels and hemoglobin A1C levels. Berberine and semaglutide also improve lipid levels and have been shown to reduce CRP, or that inflammatory biomarker. Both have also been shown to improve insulin resistance as well. Now, there are a couple of differences between semaglutide and berberine. Let's start with berberine. Here are some of the activities that are unique to berberine and not usually seen with semaglutide. So, one of the things that semaglutide does not have, but berberine does, is antimicrobial activity. So, berberine has been shown to actually reduce the presence of certain pathogens, as we've talked about. It has the ability to impact the pathogen's ability to establish biofilms. Berberine also improves gut microbial diversity. So it's been shown to selectively reduce the abundance of pathogens and have not been shown to impact bifidobacterium or lactobacillus species, which are very important for a healthy microbiome. One other thing that berberine does that we don't quite see in semaglutide is that it potentiates the activity of antimicrobial drugs, which makes it a unique addition to different protocols designed to address gut dysbiosis and GI infections. Now let's talk about some factors that we see with semaglutide that we may not necessarily see with berberine. We do know that while both do support weight loss, semaglutide has been shown to support a bit more weight loss. There are a bit more studies used to evaluate the efficacy of semaglutide, specifically with weight loss. Semaglutide also reduces appetite, and that's a feature that we don't necessarily always see with berberine. Semaglutide has also been shown to reduce the risk of mortality from cardiovascular events. And while we may not be able to necessarily say that with berberine, that is due to really the lack of research and not necessarily revealing that berberine does not also share those benefits. So now let's talk about safety and dosing. So berberine, we want to use berberine in our practice. So how should we dose it? Well, clinical studies have evaluated that berberine, and specifically in supplements, it will show up as berberine hydrochloride. It has been evaluated at a variety of doses, really ranging from 500 milligrams to 1,500 milligrams a day, and as long as 6 months in adults. Now, the most common and most effective dosage appears to be about 1,500 milligrams per day in 3 divided doses with meals. Now, common side effects, usually they're GI associated. So common side effects of berberine include diarrhea, constipation, gas, and upset stomach. Now, it's important to note that these GI symptoms are likely due to Herxheimer reactions associated with bacterial die-off. As we talked about earlier, berberine has a number of ways that it can impact the presence of microbes. And so by doing so, it is going to kill off certain types of bacteria. And when it does that, those bacteria are going to lyse open and release quite a few toxins. And in the releasing of those toxins, that is going to cause an inflammatory response and lead to a lot of the symptoms, as we discussed, that tend to show up as GI upset or an upset stomach. Now, there are long-term implications associated with the use of berberine. So berberine, as we mentioned, has antimicrobial activity. And when used for a long time, berberine can shift the diversity of the microbiome and lead to gut dysbiosis. And of course, we have to talk about drug-herb interactions. Even though berberine may be a natural product and come from natural sources, it does not mean that it is without its dangers or contraindications. Berberine is metabolized in the liver by cytochrome P450 enzymes, and it has also been shown to inhibit cytochrome P450 3A4. Now, this poses an issue because cytochrome 3A4 is involved in the metabolism of a number of pharmaceuticals, including most commonly prescribed drugs like amlodipine, atorvastatin, methylprednisolone, and zolpidem. Now, it is important to be aware, again, of berberine's ability to potentiate the action of a number of drugs. As we've talked about earlier, berberine has a unique ability to increase the activity of antibiotics and antifungal drugs, but it can also potentiate the activity of glucose-lowering drugs as well as hypertensive drugs. So when pairing berberine with these medications and prescription, it is very important that you monitor your patient closely or choose to discontinue or not use berberine per your clinical judgment. All right, so we have covered quite a bit of material today, and we're coming towards the end where we're going to talk about the clinical application of berberine. So let's talk about how to use berberine-containing botanicals. What you want to do is make sure that you are choosing herbs that are high quality. Choose herbs from vendors that are known to choose organic, well-grown, high-quality herbs, and that they are exactly the herbs that you're looking for. Now, many herbs may look similar to each other, so it is important that you are choosing vendors that are able to identify exactly the botanicals so that you know that you are getting the exact herb that you are looking for. And of course, when choosing berberine supplements, so focusing specifically on the compound berberine, you want to choose supplements that are high quality, pharmaceutical grade, and also you want to choose brands that are known for their robust scientific studies and choosing and producing a high quality berberine supplement. So let's look at different formats and modes of delivery with berberine. When considering berberine containing herbs like golden seal, Oregon grape, or barberry, you want to consider different options that you may have. So you could use a decoction, which is essentially a tea. So if you're using the herb, you'll use 1 teaspoon of the dried herb per cup of tea. And you can simmer for as long as 20 minutes. You do want to simmer for quite some time so that you are able to make sure that you are breaking down that plant material and able to get as much of the alkaloids out of the plant as possible. You can also use a tincture. Now, when choosing tinctures, again, you want to choose brands that are known for high quality products. The ideal ratio of a tincture is a 1-to-2 ratio, solvent to menstruum or the solvent to plant material. And once you have chosen your tincture, you can use 3 to 7 milliliters daily, maxing out at about 50 ml a week. And of course, those can range depending on your clinical judgment. And of course, both berberine as well as berberine-containing compounds or botanicals can be used topically. So the supplement can be mixed into creams and lotions, or you can use a compress with the plant material. And again, if you are new to using herbal products in your practice, please be sure to reach out to colleagues who are familiar with using medicinal herbs, be it a licensed naturopathic doctor or a clinical herbalist. And of course, there are contraindications. Berberine is not ideal for everyone. In fact, the use of berberine should be avoided in pregnant and lactating patients. And you, again, want to limit long-term use, especially with berberine-containing botanicals. So again, the Oregon grape and barberry, as well as hydrastis or golden seal. So for those herbs, you definitely want to do an absolute max of 2 months consecutively, again, because the long-term use can lead to microbial dysbiosis in the gut. So in summary, berberine is a bitter yellow plant alkaloid found in many medicinal herbs. It has potent antimicrobial and hypoglycemic and hypertensive activity, and it also has immunomodulatory activity as well. Berberine has been shown to support modest weight loss and also has been shown to significantly reduce a number of biomarkers associated with metabolic disease like type 2 diabetes, high blood pressure, and high cholesterol. Long-term use of berberine and berberine-containing botanicals is not recommended due to its impact and negative impact on the gut microbiome. Thank you so much for your time and attention today, and I look forward to seeing you next time on the Rupa Health YouTube channel. Take care.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.